What is vascular dementia? Vascular dementia. Most people who have dementia have the second most common type, which affects about 17% to 20% of people at some point in their lives. It happens when strokes happen or when the small blood vessels that feed the brain become blocked. The important points: more than 3 crore 20 lakh 3,400 people in India have vascular dementia, which can be caused by many different things. There are many different types. The brain has a lot of blood flow. The brain needs a steady flow of blood. There are two internal carotid arteries in the front of the neck. They form a ring with vessels from the basilar artery, which is made up of two vertebral arteries that go up the back of your neck and into your skull. This ring, called the Circle of Willis, is under the brain. It then has smaller arteries that branch off of it and go up to supply different parts of the brain. What is a stroke? If an area of the brain is not getting enough blood, this is called a stroke. The brain gets oxygen and nutrients from the blood, which also has glucose in it. Delicate brain cells will die quickly when there is not enough blood flow to a certain area. So time is of the essence. This happens in less than 6 minutes, so be quick. It is important to know that a stroke is always a very bad thing and should be treated as a medical emergency at all times. Damage to the brain can last for a long time or even kill you if you have a stroke. There are two main ways that the blood supply can be affected by stress. Ischemia. People who have blocked blood vessels do not get the blood they need to get to their body most of the time. This is because cholesterol plaques build up inside the vessel. This is mostly because the arteries have hardened up. A stroke that is caused by an ischemic attack can happen in two ways. If a plaque on a brain blood vessel bursts, a clot quickly forms around the area where the blood vessels split. If this is big enough to stop the flow of blood, then the part of the brain that gets its blood from the blood vessel may be damaged. In this case, the embolus is called a clot that forms somewhere else in the body and travels through the blood circulation to the brain. This embolus also causes ischemia, which is when the brain doesn't get the blood it needs to function. Hemorrhage. In this case, the brain itself is bleed into by the burst of a blood vessel. A doctor may be able to figure out which part of a person's brain has been affected by a stroke based on the way they look. Further tests, such as different types of scans, may help find the lesion and figure out what kind of damage there is. Each of these parts of the brain is fed by a different artery, anterior cerebral arteries. These arteries go to the front of the brain and the parts of the brain that control and sense the part of the body that move. There can also be problems with the bowel or the bladder. This is possible because these arteries also reach the frontal area. It can be hard to move your body when you don't have enough blood coming from your brain's middle cerebral arteries. These can cause a lot of different things to go wrong. These affect the part of the body that makes speech, swallow, and language work. As a side effect, hemianopsia, which means that half of the visual field in each eye is lost after a stroke, is also possible. Because if someone has a stroke that affects their right middle cerebral artery, they will not be able to see the left side of their vision in both eyes. Posterior cerebral arteries. These arteries feed a lot of the back of the brain, which is why they are important to the brain. With hemorrhage of these arteries, there can be a wide range of problems with vision. This is because this area plays a big role in how you see. These are the arteries that go to the cerebellum. A mini stroke or transient cerebral ischemic attack or TIA is when blood flow to the brain is cut off for a short time. A small stroke or a short ischemic attack should not be thought of as insignificant even if they happen quickly. These are ischemic brain attacks that can be reversed and will go away in 24 hours or less. But they are just as important to recognize, look into, and treat as full-blown strokes are too. As with a full stroke, they can show the same signs and symptoms. They can also show Very minor signs, like the eyelid or the mouth falling down. Those people should never be forgotten. You can't be sure until you get a physical exam from a doctor and see how bad the symptoms are getting. You may also need to have tests done to see if it's an already existing stroke that's getting worse. If the first is described in the box next to this text is positive, then it is time to call for help right away. You should still see your doctor even if there were a lot of symptoms that then went away. If you have had a TIA, it may not be over. It could lead to a much more severe or even life threatening stroke, which could be very bad. Because repeated TIAs can lead to dementia, they need to be looked into and stopped. The first is test. The Stroke Association recommends the first test, which tells you what to look for and what to do if someone has a stroke. First is an acronym that stands for ask the person to smile and look to see if the mouth is dropping on one side. Arm weakness. Is the person able to raise both arms? It's important to know if the person is able to speak clearly without slurring. No, they don't get it. To call the emergency number, it's now time 112 in India. If the person doesn't pass any of this test, there is enough evidence to think they are having a stroke. They will be less likely to have their brain damaged if you get them help right away. This will make it more likely that they will be able to heal. It could even save their lives. Important things. Strokes vary a lot. When someone has an ischemic stroke, it can be quick or slow to start. There might be swelling and inflammation in the ischemic area, which makes it hard to tell how far the stroke has spread right away. This is called a stroke in progress because the stroke is still getting better and better. These types of strokes happen very quickly and they are called hemorrhagic strokes. They are more likely to cause a headache because they happen when a blood vessel bursts. As well, they are more likely to be fatal than stroke that are not caused by blood clots. It is called a transient ischemic attack or TIA when a person has a mini stroke even though they don't know it. This can lead to one of the types of dementia that happens with blood vessels.